Hey guys, it's Charles and welcome to Good Clinical, a podcast and YouTube channel dedicated to showcasing the future of medicine and human health. Today's podcast episode is another in our partnership with Te Titoki Mataora, MedTech Research Translator. And today's guest is Dr. Pat McHugh. Welcome to the podcast, Pat. It's great to have you today.
Yeah, kia ora, Charles. Yeah, nice to be here. So I'm not a champion at I've done a lot of these before, but we'll see how we go with this afternoon. Kia ora.
Absolutely. Let's get stuck into it. So, Pat, you're based down in Tairāwhiti, Gisborne, and you are affiliated with Turanga Health. So why don't you give us a quick overview of your background? So you're a master of many different things. So GP, research scientist, you're involved in a lot of different things, aren't you?
Yeah, so originally from Gisborne, Charles. Trained medicine down in Dunedin back in the 80s, and came back to Gisborne for 1 year, and one became a few more, so I'm still here. But the long and short is I work across a variety of roles here in Tairāwhiti. So I'm a vocational registered GP and also in rural hospital medicine. Work part-time in the emergency department, a day a week with the opioid treatment service, also some GP teaching with Turanga Health, trying to develop some community services, and also have a part-time role with Mātai, a recently established MRI research facility. So as you alluded to, a jack of all trades and master of none, really.
Can one be a master of all trades? Surely.
It's a work in
No, that's
progress.
that's great. And so you're obviously you're featuring on this podcast as part of your involvement in some research projects that are under Te Titoki Mataora, but one of which invokes a lot around heart rate variability, which I've heard on a few different settings to be a lot to do with one's physical health. But I was surprised to hear that. We'll read in the backstory here that heart rate variability is also quite an important indicator or proxy for mental health as well. Why don't you provide us with a quick overview of what the importance of heart rate variability in terms of one's general health altogether?
Yeah, well, a few different comments. So in some ways we recognise the head as a centre of consciousness. Also within different philosophies, the idea that the heart itself is also a centre of consciousness. And so that the head and the heart are connected through the vagus nerve. And a lot of the original thinking was that the vagus nerve is all one-way traffic from the brain to the heart. But now we're appreciating that perhaps 80% of the traffic is actually from the heart to the brain. And so the heart and brain communicate in different ways. So there's the hardwiring through the vagus nerve and autonomic nervous system, but also there's a pulse pressure. So with the pump, the hydrostatic pressure, also electromagnetic, and so that the electromagnetic field of the heart, for example, is some 100 times stronger than the electromagnetic field of the brain. And there's also hormonal connection, so that they do connect and communicate in different ways. It's not just one-way traffic from the head to the heart. But coming back to your question about heart rate variability, is that as that any biological system, the more choices as to how a system has of responding in a given situation, the healthier that system. And so our heart rate is not smoothly constant each beat to beat. And in fact, if we lose that variation and it becomes more and more constant, it's a bad prognostic indicator. And so the healthier, by and large, the healthier someone is, the more variability they have in the heart rate. So the wider the range in terms of minimum range of the shortest beat and the longest beat over any length of time. So does that make sense there, Charles?
Yeah, that's really interesting. So it's a heart rate variability. We often think, okay, so your heart rate is 66 beats per minute, and we go, okay, or 60 beats per minute. Let's make it even more simple. It's one every minute, every second for a minute, But that's not quite an adequate representation. That's the average over a minute. So your heart rate would vary. The interval between individual beats would vary quite. And that's the measure. So how variable it is in terms of between each beat is a measure of your heart rate variability.
Correct.
Right?
And then so some of those beats might be at a rate, if they were continuous and regular, at a rate of, say, 50 beats a minute, with some maybe at 70, 75 beats a minute. And so there's a range of how the length of those beats vary over that minute and over the time
Yeah.
frame.
And is that the what's causing that variability? So it's part like how many like you mentioned, how many options that system has essentially, but what is influencing, say, my heart rate right now? I'm sitting down, it's going to be fairly constant, right? Is it my heart adjusting to certain parameters, or is it my brain adjusting my heart? Which direction is that heart rate variability being influenced by?
Yeah, well, there's a whole host of factors that increase or decrease influence the heart rate. And so there's what's called the sinus arrhythmia. So as we breathe in and breathe out, then the blood is drawn into the lungs and the heart at, sometimes when we're breathing in, then blood is drawn into the heart and lungs. And as we breathe out, then that's changing that pressure. So our heart rate has a variation related to our breathing. And so physiologically, we call that the sinus arrhythmia.
I
But
see.
there's also other factors at play apart from just our breathing. And so we have what's called in brief, we have what's called our autonomic nervous system, which has two parts, a sympathetic and a parasympathetic. So just in one way, the sympathetic is a bit like an accelerator, and the parasympathetic is the brake. And so for the heart, there's the sympathetic nervous system, and the main parasympathetic nerve to the heart is through the vagus nerve. And so by and large, we recognize that improving vagal tone, so the more traffic through the vagal nerve, then by and large, the slower the heart rate on average. But an improved vagal tone is related to improved health.
Interesting. So presumably, you can improve your vagal tone over time. If it's a prognostic of good health over time, one would assume you would want to train that to be more pronounced than the sympathetic side, constantly aggravating your heart rate and increasing
Yeah,
your
well, in
stress.
part, the sympathetic nervous system is a bit like an accelerator, just as a rude, rough analogy. And
Fight or
so it's
flight.
also related to the fight and flight mechanism. So if we get a fright, we have more adrenaline in the system, the sympathetic nervous system kicks in, and so by and large, our heart will beat at a faster rate, ready for that fight or flight. We also have the vagus nerve through the parasympathetic nervous system, and so when the parasympathetic nervous system is activated, then we're getting blood diverted to the digestive systems, and by and large, we're becoming more chill and more relaxed.
Mm.
And so there's a play at work between the parasympathetic and the sympathetic nervous system. And so part of that is how do we turn down the sympathetic nervous system and allow the parasympathetic to kick in to allow someone to be more relaxed and less anxious.
And that's a really important thing to pursue, right? Because so much of modern life is as acting on, or at least I feel like it is. It might be anecdotal, but acting on the sympathetic nervous system. There's constant stimulation. There's constant stresses. There's constant, just mental or physical stress. Our lives are occupied by so much information and data and change, and the world just whizzes by like crazy. I often kind of think that it'll be nice just to put modern life on hold for a bit and go chill out in a cave for a couple of days and eat apricots by the fire, but like our forefathers thousands of years might have done, because modern life is very, very stressful. So one would need to get better at turning that down. So what can we do to better stimulate the vagal side and relax? Is that meditation?
Yeah, and so there's an area of mindfulness which so most of us have heard of or even dived into to explore. And so mindfulness itself has a few different components. So part of that really is looking at how we develop a witness state, a non-judgmental ability to actually observe what we're thinking, feeling, sensing, intuiting at any point in time, which helps give us more choice as to whether we stay with those thoughts or otherwise. And also just other parts to it about being patient, about trusting, about a beginner's mind, acceptance. So there's different components to it with the whole area of mindfulness. And most forms of mindfulness will also have a form of meditation associated with it as well. And so there's
Mhm.
all sorts of different forms of meditation. Some may be about trying to quieten the head, whereas the approach that we're taking here in Tairāwhiti is around how we actually can open up the heart and access the heart as a centre of consciousness, and also enable us to be more able to find peacefulness and calmness in our lives.
Excellent. I mean, why don't we talk about the scale of the problem, right? Because again, modern life, very stressful. There's some pretty terrible stats out there that, most adults will experience some kind of mental distress or anxiety or what have you in their lifetimes, and that's a big drain on one's personal life, but also society as a whole. So, yeah, in terms of the impact of mental illness, what are we dealing with here, Pat?
Yeah, well, in many ways, the way I would regard it, in some ways, it's an accumulation over time of different stress. And so, stress itself isn't a problem, it's how we respond to that stress. But by and large, if we're in a negative emotional state, for example, like if we're angry or frightened, we're tending to tighten up in the body somewhere. Whereas with using a heart-based approach, then if we can access that calmness or peacefulness, then most people would be able to appreciate there's an expansion from the center of the chest, which is helping to let go of that tension and tightness that people have accumulated. And so, as you alluded to, our lives are busy. There's all sorts of stresses and strains, and so over time, people tend to become more have accumulated the tension, stress in their physical being, which affects them not just physically, but also mentally, emotionally, and some people would also argue spiritually. But how do you actually sort of let go and diffuse some of that tension and access peacefulness and calmness as a way of letting go that the emotional baggage we tend to accumulate during our passage through life?
Mhm. It's really interesting because I find like a solution to mental stress or stress in general is the mind. The secret, the treatment to the problem that is in here is also in here, but can be facilitated through physical activities or heart mindfulness, as you've been talking to. So, what kind of protocols are you looking into with your research project, which kind of combines all of these different topics? So, the mindfulness, head and heart, heart rate variability. What does that research look like, Pat?
Yeah, well, different comments there. So we're looking at offering some sessions to individuals who get referred into the program who may have degrees of anxiety or stress in their lives. And so we're using some recognised questionnaires just to assess their levels of perceived levels of anxiety, and also doing some measures with heart rate variability in terms of before and after. And so, as I mentioned before, the heart rate variability provides an opportunity to get an objective measure of someone's stress or anxiety levels. And so we're looking at, over time, being able to offer them sessions with the heart-based mindfulness, getting some measures of heart rate variability as well as the questionnaires, as I mentioned, and then just seeing whether over time they're changing or not.
Yeah. So, are you're testing a specific mindfulness protocol and using both subjective measures, so the questionnaires, and the objective measure being the heart rate variability to test the efficacy of those that protocol, that mindfulness protocol?
Yeah, so I've had some training in some heart-based therapeutics with what's called an emotional clearing process. So over the years, I've been to various retreats and workshops and to explore more the heart-based mindfulness. And feel much more comfortable now over the last few years where I can actually use that in various clinical settings. And from my own experience, I found it very helpful with people with anxiety, with low mood, also if they've been through trauma,
Hmm.
with forms of post-traumatic stress disorder. And so now just at the stage where I'm curious as to whether we can replicate some of those results in a more formal research setting. And so that's with my liaison with likes of Andrew and Fiona there in Auckland around how we can actually develop the whole process just to see whether, when it comes down to it, it is helping people at a deeper level.
Yeah, right. So it's getting. Am I right in saying moving from the anecdotal evidence into an actual, robust trial research body of evidence for a protocol such as that one?
That's what we'd like to do. I mean, at this stage, it's more um, the entry criteria people, by and large, people with anxiety, and then offering them the sessions with the heart-based therapeutics emotional clearing process, and then just seeing whether we do get some improvements in terms of the questionnaire outcomes or the heart rate variability. And depending on the outcome of that pilot, then we look at hopefully diving into that a bit deeper and just exploring a bit further, especially with the heart rate variability.
Yeah, fantastic. So can you take us through what that mindfulness approach looks like, those sessions? So there's not, it's not just one session and someone comes in and they've got a bit of anxiety, or they do 30 minutes with you or one of your collaborators and then they're away laughing. It's a bit more involved than that, isn't it? It's a fairly
Yeah,
comprehensive
yeah,
thing.
and so it's a conversation with an individual where we're looking at just working through getting to know each other so they can actually feel safe and comfortable in terms of having a conversation. And we're not looking so much, if there is an anxiety state, not looking so much in terms of doing some intensive psychotherapy to explore why they have the anxiety state, but more looking at how they can, using some forms of mindfulness, especially the heart-based approaches, look at how they can develop some tools as to how they can manage their anxiety.
Mm-hmm.
And so there's a conversation about various aspects around mindfulness, but also at some stage looking at the emotional clearing process, which is a form of a guided meditation, if you wish, where we're getting the individual just to sit comfortably, closing their eyes. We go through some progressive muscle relaxation, and at some stage we get them to touch their heart and just to smile out in the room. And quite quickly, using that's a brief summary of the process, but quite quickly they can start to feel some form of relaxation, some peacefulness or calmness. And each time we go back in again, it gets a bit deeper. And once we get into a deep enough state of peacefulness or calmness, then we can use that deeper state to then dissolve any knots of anxiety or anger or sadness or fear or guilt that they've been holding on to.
Mm-hmm.
In short, yeah.
Yeah. What got you interested in this field of research, Pat? Was there is there a personal connection that you have with, mental health or anxiety, or is it a purely academic interest of yours?
Yeah. Well, I suppose as a younger person, I'd chosen medicine and I thought I'd actually get more into research pathways rather than ending up in general practice. And so, in some ways, I accidentally end up in general practice here in Gisborne. But I've always maintained an interest in research and have been curious about things. And some of the patients that came to see me as a young GP were telling me stories that I couldn't explain, given what I've been taught at medical school around how the body was thought to be put together.
Mm.
And so over the years, I've explored different forms of meditation and some other aspects. So I've had trained in what's called Bowen therapy, neuro-linguistic programming, and also tried put my foot in the water with the various forms of meditation until I came across the heart-based approaches, which for me is a much more effective form of meditation than the other approaches I'd tried. And so the irony being that as a medical student, I was taking the piss out of the biomedical sciences and thought they were very soft and waffly, and not hard sciences at all. Whereas now my real interest is in the mind-body connection and how the mind and body are connected, and also what tools there are there to help someone get more choice and awareness around their own way of reacting and responding in the situation, to try and empower them to have more choice as to how they do respond.
Yeah, well, that's super interesting. I mean, I find this kind of stuff fascinating because it just goes to show how much medicine is evolving over time, right? We used to treat everything very discreetly. We have specialties that are based on, single body systems, skin or whatever, digestive, but everything is integrated, right? I mean, people talk about the gut brain axis, there's the heart brain axis, and there's obviously the adrenal axis as well. Everything is integrated. We're not like these little, just discrete systems that work independently, but there's all this feedback constantly. And I think we like to romanticize that the brain is in control all the time, but it's really clear that you mentioned there's the 80% traffic going from the heart to the brain as opposed to the other way around. I mean, surely that in itself would have been a massive paradigm shift for our understanding of I don't know, cardiology or something. I mean, to know that the traffic is going the opposite direction, that would have been quite momentous, surely.
Um, yeah. Although I suppose that with medicine, part of it is that once you get sort of down a path, it's very hard to sort of, go backwards, or how to explain it. It's a bit like as a hospital specialist there, have a huge depth of knowledge in a particular area which is quite narrow.
Hmm.
I'm more a generalist, so I don't have nowhere near the depth of awareness and knowledge, and so mine's a lot shallower, but in some ways it spans across a variety of disciplines. And so in some ways I don't have the vested interest in maintaining the awareness around that depth of knowledge
Mm.
and am as committed to it. So it's easy for me to step back and ask, is this something that's, are there some other ways of being and doing and exploring it? I'm sorry, I haven't explained it very well, really, but as a
Yeah,
generalist, we're
I
more
understand.
open-minded.
Yeah, for sure. I mean, the inertia or whatever you want to call it about the trajectory that a specialty is taking can be quite difficult to overcome. But that's why we need generalists, right? Because they can see things for what they are across domains. You know, if we all were completely siloed, chances are we'd be digging down, digging in the wrong direction, and no one tell us that hey, the actual thing we need to be heading towards is not there; it's actually there. Why don't we take a U-turn and
Yeah, and the
start
growing
taking
school
this
of
way?
thought that in terms of scientific advances, it's going to become more between linking up between the different silos as opposed to any silo itself digging deeper and deeper and deeper.
Yeah, absolutely. And within specialties, there's like subspecialties. I was talking in a previous episode about the interlinking between Parkinson's and dysphagia. Dysphagia being the difficulty with swallowing. I mean, that's a symptom of Parkinson's, but can also happen from traumatic brain injury. Can also happen from other neurodegenerative diseases. So you don't want to just study dysphagia in the context of Parkinson's, but it's also in the context of all these other ways that could link into that. So, yeah, I like that thought that the future is not within it, the silos, but it's within the network of everything working together. So, looking forward to the implication of or the outcome of this research. So, you mentioned pilot trial, pilot study now, and then you'll do would it be a larger study with greater connection to or greater emphasis on the heart rate variability and thereby have a concrete amount of evidence to support this mindfulness approach?
Well, I'm hoping so. I mean, so the some of these scientists I'm involved with here in Auckland, with Andrew and Hector and Fiona, for example, have a strong basis in physiology, and so that's one of their interests. And so, how we can explore that collectively and explore how useful heart rate variability is or isn't in terms of an outcome measure, let alone as an intervention in its own right.
Right. Yeah. And if we were to fast forward 5 years, what would you like the outcome of this research to be ideally in terms of a utility, from a utility perspective? Um, mm,
Yeah, well, I think part of it is medicine. If I'm practicing a day of general practice, I'm having, in some ways, a similar conversation one on one with a number of individuals during the course of that day. And so I think in healthcare delivery, there's a huge amount of opportunity to be able to do more group based interventions. And so how we're, as with Turanga Health, for example, we also run some dietary interventions around a kaunuku, which is a whole food plant strong approach, and also um, with a low carb, healthy fat approach. And so trying to give people the choice, but in many ways, group interventions around lifestyle are much more effective in being able to deliver, using less people to deliver the same content, but also when individuals go through that group-based activity together, it's actually a better outcome for them as well by different dynamics happening within the group system. And so what I'm getting to there is that over time, I would like to see more mindfulness, whether it's heart-based or not, but more opportunity for healthcare to be able to using that early on in the course of maintaining health with a focus on wellness rather
mhm,
than a disease-based approach. And so, I would hope that, over the next 5 to 10 years or however long, there's going to be more focus on mental health, emotional health, and how we can develop tools to help maintain and improve that, as opposed to
mhm.
waiting until things really got that desperate where it's a lot harder to be able to successfully intervene.
Absolutely. It's the importance of having preventing someone from falling rather than having an ambulance at the bottom of the hill waiting for them once they've fallen. It's that preventative. early intervention. So why is the group setting that much more effective in these types of interventions? What is it? Is it just a reflection of our innate kind of like biology, sociology, our social structures, our history of being very, very social creatures, becoming more and more atomized as time goes on, it would seem? What's so special about the group-based approach?
Yeah, well, there's a variety of factors at play. I mean, there's the enjoyment gained from bonding in a group, and so that people come along on a regular basis, they start forming connections with the other individuals in the group. That some people will be early responders, where they'll get the idea that's been taught and they'll respond, and so someone else who hasn't responded as quickly or as well will actually look and see, oh, okay, perhaps I need to persist with this a bit longer. And so the early responders will drag others along as well. And people sort of tend to, for various reasons, they may sort of, fall out of the waka for whatever reason in terms of some other distractions. And so having that group dynamic allows other group members to be able to pull them back in again. And so it's a more horizontal process as opposed to a top-down process where there's an expert delivering the knowledge.
Mm-hmm.
As often in healthcare, we tend to think that it's about education, when in really, if someone's going to change their behaviours, they need to feel good about themselves. And so sometimes telling someone off to stop smoking or stop doing this or whatever else doesn't actually empower them to change their behaviour. In fact, it often sort of tends to drive the behaviour underground and actually makes it harder to deal with. And so from my own experience, the group-based interventions are so much more powerful and effective and economic and efficient, and so we should be using more of those in healthcare delivery, really. And so Turanga Health climbing into that and looking at how we develop the group-based interventions to give people more choice around that aspect.
Right. And is Turanga Health kind of unique in that regard, given that they're an iwi health provider, or is that all kind of moving in that direction across the board in Health New Zealand?
No, not at all. So I would think that most, if not all, iwi health providers do heavily use the group-based interventions.
Mm-hmm.
Within the Te Ao Māori approach, it's all about the relationship, how we relate to each other, as opposed to a more reductionist Western approach to life, which is more transactional. And so there it's about the engagement, how do we get engagement with an individual and form the relationship first before we look at any other transactional components that may fall out of that or follow on afterwards.
Right. So I imagine if successful in the group-based approach, you would want, and it's beneficial, stands to reason that could usurp the current status quo, the current Western top-down hierarchical transactional approach.
Yeah, I don't see it usurping it, necessarily. I see there's going to be a huge want and need for that, but the healthcare system itself is in crisis, as we're hearing regularly in the media. And we need to look at how we can be more innovative and transformational as to how we deliver healthcare services and more around the fence at the top of the cliff rather than the ambulance at the bottom of the cliff. And looking at lifestyle, as in many ways, dis-ease falls out of lifestyle. And so we need to look at disease more from a lifestyle perspective and lens as to how we can be looking at maintaining and encouraging more activity, looking at eating healthier, looking at connections and relationships, looking at our mental health in terms of how do we relax and enjoy and get meaning out of life. And so there's all sorts of other lenses we could be and should be looking at it through, rather than necessarily just through the biomedical lens.
Absolutely. I mean, I think we all went through the COVID period, billeted to our houses. What I worked from home for all those years, 2020 to 2023, and my daughter was born in between lockdowns 1 and 2, and you got this sense that, well, we can still, for whatever reason, we can still do a lot of what we were doing without most of us, urban professionals, shall we say, traipsing into the office, so you can be all very remote and you can still get your job done, and it's all very convenient and it's all very efficient. I don't need to, put gas in my car. I don't need to, brush my hair. I don't need to brush my teeth. I don't need to wear nice clothes, all these kind of things. And yet I do know better, but one could argue that I mean, I could definitely argue that my mental health was never worse than during that efficient period of time. My physical health was never worse during that efficient period of time, you know. And we completely have had to almost relearn all the basics of what it means to be kind of physically and mentally healthy from that period of isolation and atomization.
Yeah. And coming back to heart rate variability, I mean, we tend to underappreciate just how important that human-human interaction is. For example, with the heart rate variability, there's research done which has shown that if a boy walks into a room with his own dog and starts thinking about his dog, their heart rates tend to synchronize. And so there's research which shows that the electromagnetic field of the individual can be measured several meters outside from the individual. And just, in
Wow.
some ways, looking at the heart rate variability gives us an opportunity to look at, some of the frequencies and some of the coherence rates with that. For
Mm.
example, there's some work being done with a group called HeartMath in the States, where they've looked at measuring people's heart rates over days to weeks. And what they've found is that if they're meditating, then they tend to develop a bit of coherence with what's called the Schumann resonances, which are some of the electromagnetic waves that surround the Earth. And where if they're not meditating, they tend to not be as coherent with those Schumann resonances. Yeah, and so the point I'm trying to make there is that that human interaction face to face, there's a lot more happening there
Mm.
in that interaction than we appreciate necessarily.
Yeah, absolutely. I mean, I heard, I was listening to this podcast. This physicist was talking about what reality really is, and they were likening it to. I'm going to butcher this analogy, but they were likening it to how what reality is not what we see. Right? Reality, physical is physics and chemistry and biology. The raw material that goes into it is not what we see. So the computer that I'm looking at is not actually there. Right? It's this assemblage of atoms and protons and neutrons and blah blah blah, all doing their things. Um, but what we see is the interface. It's a bit like the operating system has an interface that we can interact with on the computer. The world, we don't see what it really. We see the operating system of it, but we're limited by our senses, right? So we only see in the visible spectrum of light. We only hear in a certain frequency. We only see certain types of electromagnetic radiation. So we've kind of reduced this world around us into what we can perceive with our five senses. But there's a lot more going on. Just because we can't see it or perceive it consciously doesn't mean it's not there. It's a
Aye.
fascinating kind of concept. So, Pat, this has been really, really interesting. Are there any other things happening on the horizon for you and your group in the realm of research into this area?
Yeah, we've got other pokers in the fire, so to speak. As I mentioned, we're doing some work around group-based interventions with diet, around a whole food plant-based approach, and also a low-carb, healthy fat approach. Interestingly, we're also getting some research happening around psychedelics. And so I'm involved with a group based at Warengawahu Marae. We were looking at exploring how. So in the next few months, we're putting 12 healthy Māori participants through an experience in psilocybin, which is the active component of magic mushrooms. And we're working towards being able to hopefully explore how useful the psychedelic experience in a controlled situation in a therapeutic process can be used for people with methamphetamine substance use disorder.
Wow.
Yeah. So that's a
Very.
work in play at the moment, which is a separate conversation. But there has been a lot of research done back in the '60s around using psychedelics in an assisted psychotherapeutic process.
Yeah, wasn't there a big decision recently around the use of MDMA made by the FDA, and they kind of knocked it down from being approved in the use for, was it PTSD? I think in the last couple of weeks I saw some kind of outcome there, which is a bit disappointing for the industry.
It was disappointing, although that said, in Australia they approved late last year using MDMA and also psilocybin for psychedelic assisted psychotherapeutic processes with psychiatrists. And so that is happening there in Australia.
Oh, right. Well, that's good progress. So typically what happens is it might happen in Australia and then it'll make its way to our shores as well.
Yeah, although we do see the light before Australia, so hopefully we'll sort of kick in and get things happening sort of in the very near future.
Very good. Pat, this has been really, really interesting. Where can people go if they want to find out more about your research or things on the horizon with your group?
So we haven't published anything at this stage, and so that still is a work in progress. Hopefully, we'll have at some stage in the not too distant future. But if they are interested in heart rate variability, there's quite a few different things online. I've tended to look at a bit of the heart math, and so they have different stuff there around some of the research that they've performed. But you mentioned that there's Whoop, which is some other devices that people can wear to measure their own heart rate variability. So there's various things out there at play.
Very good. Well, thanks, Pat. Really appreciate your time. Go well, and we'll be on the lookout for when that research gets published.
Cheers. Kia ora. Thanks, Charles.